your perspective, what problem was technology originally meant to solve in healthcare?
Just suppose like if the data is scattered across multiple tools, the decisions slow down and the risk of error increases, and the human life is involved. Any wrong data points or any slowness to the data access or any delay to that can cause a lot of like complexities.
Yeah, can you explain to our listeners at what point did healthcare become too much tech? Or do you think that healthcare today suffers from tool overload? If you could give one piece of advice to healthcare leaders, CTOs, or founders listening today, what would that be? Hello, I am Shelby, host of the Better Health Tech podcast. I've spent the last 15 plus years working at the intersection of technology, marketing, and product development in health tech. And this show is all about breaking down the ideas, tools, and people moving healthcare forward. If you're curious about how healthcare is really evolving behind the scenes, you'll want to hear today's conversation. Joining me today is Mohammed Atif, CTO at PureLogix, and someone who spends a lot of time thinking deeply about how technology can truly move healthcare forward, not just in theory, but in practice. Thank you for being here today and welcome to the show.
Thank you, Shelby. Nice to be on the show.
Yes, and so the topic of today is health tech actually making healthcare better. In our very first episode of Better Health Tech, we ask a simple but important question. Is health technology truly improving healthcare or just adding more complexity? We explore AI, digital health, real challenges, and what meaningful innovation really looks like. Technology entered healthcare with a promise to improve care, reduce errors, and make systems more efficient. But has it really lived up to that promise? From your perspective, what problem was technology originally meant to solve in healthcare?
Yeah, so in my opinion, tech was entered in the healthcare to like solve the three problems. The first one was access. Now the access to the all the data, digital health record, telemedicine, and remote monitoring were meant to be make healthcare available wherever the patient is, not just inside a hospital. The second important part was about safety and consistency. So healthcare is incredibly complex, and tech was introduced to reduce errors, limit variability, and support better clinician decision making by standardization of the information. And the third part was about efficiency. And the goal was to reduce like paperwork, streamlining all the workflows, and giving the clinicians more time with the patient. But right now, what we see that they are mostly spending their time on the screens, on all the paperwork, on all the flows. And intention was never to replace a human care. It was to support clinicians, improve outcomes, and making the healthcare systems more reliable. So I see that things went off bit of track in some cases, like where we focus on like just digitizing these processes instead of rethinking and solving the actual problem.
So, looking back, did early health technology solve the right problems? What's your perspective on this point? When we digitized healthcare systems, did we rethink care or just digitize existing workflows?
Yeah, so Shelby, I think in many cases, no, not fully. I see that we have mostly digitized the existing workflow instead of rethinking how care should actually be delivered. Like we have taken all these paperworks, manual flows, and just put them on the screens. That gave us scale, records, and data. I mean, we can access all these things, which are important part to move forward to the next stage. But it also meant we carried a lot of inefficiencies that were part of the manual system, like of all the paperwork manual system, and we are still feeling this impact today. So, in my opinion, uh, we digitized the healthcare, we didn't redesign it.
Okay. Yeah, that's good. So, how has technology changed healthcare practice over the years? What are the biggest shifts you've personally seen since adoption began?
Yeah, so tech has changed healthcare by improving access to the information, enabling the remote care, and supporting faster and more data-driven decisions. Like I can see the doctor can access all the medical history, all the data about a patient at a single click, and they can make the decisions right away. But at the same time, it has increased documentation and screen time, which has changed like how clinicians spend their day. The impact has been real, but mixed. So, in short, you can say tech made care more connected, but also more complex.
Yeah, can you explain to our listeners at what point did healthcare become too much tech? Or do you think that healthcare today suffers from tool overload?
Yeah, so healthcare became too much tech when tools started piling up without integration. So by integration I mean we have traditional EMR, EHR, and we all know that it's very hard to get data out of them and to communicate with them. There are a lot of compliances, I understand. There are a lot of security protocols that one has to follow, but still, like the way they have been designed, any modern application or any modern tool, if we try to like lay over that, it adds more complexity due to the missing interoperability or missing connection between these tools or these applications. So there's a definite like tool overload today, like multiple system doing parts of the job but not talking to each other, which adds cognitive and administrative burden instead of reducing it. So in easy words, the problem is not too much tech, it's too many disconnected tools.
Yeah, that makes a lot of sense. In your opinion, how does this impact clinicians, patients, or decision makers in healthcare?
Just suppose like if the data is scattered across multiple tools, the decisions slow down and the risk of error increases, and you know the human life is involved. Any wrong data points or any slowness to the data access or any delay to that can cause a lot of like complexities. So which ultimately affects the patient experience and outcomes. So tool overload distracts clinicians and dilutes good decision making.
How has technology changed healthcare practice over the years? What are some of the biggest shifts that you've personally seen since tech adoption began?
Yeah. So tech has changed like healthcare by improving access to information, like it is accessible because it's all digitized. It has enabled remote care and it is supporting faster and more data driven decisions because we have all the visibility on the vitals and all the other in detail parameters that are required to make the decision. At the same time, it has increased documentation and a lot of screen time, which has like changed how clinicians spend their day. The impact has been real but mixed. So in short, you can say tech made care more connected, but also more complex.
Can you please explain that a little bit to our listeners? Like, at what point did healthcare become too much tech? Or do you think healthcare today suffers from tool overload? What are your
Yeah.
thoughts there?
So Shelby, healthcare became too much tech, like when tools started piling up without integration, right? Yes, there's a definite defined tool overload today, multiple systems doing part of the job, but not talking to each other, which add cognitive and administrative burden instead of reducing it. So, in easy word, the problem is not too much tech, it's too many disconnected tools. They need to have better interoperability, they need to talk to each other, and information should be like flowing from one system to other system using all the best practices in place like HL7, FHIR, which are required.
Makes a lot of sense. So, from your perspective, you are a CTO. Um, you're on the technology side versus clinicians, patients. People who are actually adopting the technology. So, how does this impact clinicians, patients, or decision makers in healthcare?
Yeah, so I think when data is scattered across tools, what I see the decision slow down and the risk of error increases, which ultimately affects the patient experience and the outcome. So, as a patient, I think they should be able to get right care on the time. As a doctor or as a provider, I should be able to have access to all the medical records, all the details, previous history, like what kind of allergies a patient has, what is their medical history, if they have any complications. So I should be able to make the decision right away. And as a staff or administrative, staffing, so I need to make sure that I have less screen time. I should be able to use the system with ease, and I don't need to spend too much time clicking screens here and there. And the experience should make the life easier and things moving forward.
Yeah, that makes a lot of sense. So, in your opinion, in which areas has technology clearly improved healthcare outcomes, where there's a clear line and you see that it really has improved healthcare?
Yeah, so tech has clearly improved outcomes in areas like telehealth, diagnostics, predictions, remote patient monitoring, and also data-driven population health. And one more thing I have seen that it has made uh, care uh, n- less expensive for the remote areas or for the people who can't afford by using those. And these implementation worked because they solved specific problems. They integrated into existing workflows and were designed with clinicians in mind, right? So health tech works best. What I see that when it is focused, integrated, and built around the real clinician needs. Like Shelby, one of the recent example, I have been working here with a startup in New York City. So they are trying to train their own AI LLM. The purpose is that we can take the picture of the eyes and it can detect the malaria. And the application is to use that application in African countries where the people don't have access to the care provider or it is too expensive for them. And nowadays, everyone carries these mobile gadgets. They can just take a picture and we can detect if the person is affected with malaria and can take it to the right care as needed. So these are kind of solutions that are really adding value that is trying to solve problem. And I think and I see a lot of innovation happening in this domain.
I'd love to hear a lot more about that. So you're leading PureLogix, a company that has worked at the intersection of healthcare and technology for many, many years. From your perspective, what expertise does PureLogic bring to this space? And tell me a little bit more about PureLogix
Yeah.
and what your company does.
Yeah. So we Purologic started back in 2006. Uh, and the story behind was that to help the entrepreneurs and the founders who are looking for right engineering partner to help them to take their ideas to the market and then helping with the future phases as well. We started with three people, with three founders. Now we have a team of 400 plus engineers, and we are a global company with headquarter in New York City. Uh, we have been doing a lot of work in healthcare, and healthcare has been one of our major vertical in the healthcare. Like we have built telehealth solutions, EMR, EHR solutions. We have built revenue cycle management applications. We have recently been working in discounted drug programs where we have been building some rebate management platforms. On top of that, we also help companies with the certifications like HIPAA compliance, FDA compliance. Uh, we have also helped companies with short script and German certifications because these are some of the things that are required when you are trying to build specific healthcare applications. At Pure we have worked all across these areas like digital health, data engineering, AI-driven analytics, workflow automation, and security has been one of the top thing that we all always take in mind. So back in the days when we started working in the healthcare industry, what we did that we introduced special trainings for our developers. So we have a complete HIPAA developer training program within our organization. So whoever is going to work on these healthcare applications, they have to go through this training. And this training consists of four prominent areas around security, privacy, uh, uh, alerts or notifications, breach notification. So, and all the focus is on the EPHI, that how we can make sure that electronic patient health information is kept secure and the wallets and key wallets are also secure. And whoever pass those certifications or training programs, they are deployed on these healthcare application development projects. Uh, on top of that, we have a separate training department whose job is to keep initiative on the latest practices to build scalable and reliable healthcare applications every 1 to 2 months or every quarter. And we also try to roll out different assessment at different level to ensure that the engineers or the teams that we have, they are up to the mark and they know all the latest practices in the healthcare application development domain. So these are some points that differentiate us from other companies and how we have built our authority in the healthcare domain.
Oh, that's very, very impressive. I think that it's so important for security and healthcare, and there's a dime a dozen technology companies out there, but it's really impressive that you um, care so much about it. You actually have training and all of the above. So I think
Yeah,
that's amazing. Um, so one of the areas where technology seems to be making a real difference is in diagnostics, especially when it comes to speed, accuracy, and early detection. So, from your experience, how has this technology changed diagnostics, and where do you see it creating the most impact today?
yeah. So thank you, Shelby. So I agree with you that diagnostic is one of the areas where tech has had some of the clearest and most measurable impact, right? And I'm giving this statement from personal experiences as well. So I have been working with different companies. Like one of the startup we have been working, they were trying to work on diabetic patient treatment. So we what we did that we built a smart thermal imaging technology for them, where like we can take the picture of the diabetic patient feet, and that capture a thermal image using the FRAIR device, and then uh, we build an algorithm with their biologist and scientist, and that image goes to the server, and using the like computer vision image processing, it tries to calculate the temperature on different parts of it and help the doctor to better prescribe. uh, so that is one of the example, like in the AI computer vision and image processing. Another like interesting example that I have in mind, back in 2019 were working with a company who were building pregnancy strips. So they were totally non-digitized. So they came to us and they said they wanted to go digitize and they wanted to be a tech firm. So my product team spent time with their manufacturer team and their biologists and scientists. So we came up with an idea that we build a mobile application where we can take the picture of the pregnancy strip. So now the based on the color coding that we have on the pregnancy strip, that goes to the server and it can generate like clear uh, home fertility complete report, and it can help the woman to have better fertility, and they can test their hormones as well, and it was giving the same result like just like a lab level insights. And that application has won multiple awards and it's FDA cleared as well. So that is another example like where I see the tech has really added impact. And most recently, I have been working with another firm here in New York City. They are working on uh, alcohol test. So what we can do that we can take the picture of the eyes using the infrared camera of the mobile, and it can see the size of pupil, and it can see if it is the eyes are twitching at a specific angle,
Wow.
and then it can also monitor your heart rate. So taking these vitals, it can tell you if the person is affected. And the plan is that if this goes well, we are going to deploy it as that application in governance, and police can use it like for testing if anybody is affected right away. So these are some areas where I see that tech is really adding an impact, and it's making the care available at cheapest cost and available to everyone at their like hands at any time.
Yeah, that's amazing. The impact that technology has on humans has evolved so much over the years, and to see, the good impact is always great. But there's always a negative side to something.
Yeah.
So, in your opinion, where has technology failed to deliver on this promise? What are
Yeah.
some examples that come to mind?
So I think tech has struggled mostly in areas like EHR usability. I see there are a lot of like disconnected clinical tools and administrative systems, and especially these traditional EMR, EHR. I have faced a lot of challenges while designing these applications and system that it has always been a challenge to communicate with the EHR and EMR to get the patient data. And there are a lot of like compliances, permission set. I understand that is required for security purposes, but those EMR, EHR, I guess they are over-engineered and they are not flexible with the need. So we really need to make them interoperable so they can communicate with all these latest AI applications and tools. And the goal is definitely to make care access available for the patient and giving all the visibility to the doctors or providers so they can provide you the care with the right data set. Like let's take example, if you want to switch your PCP today, I mean the major question that will come to your mind that okay, how my medical history will be transferred to the next PCP, right? Or if you are moving from one state to other state. So these are the main questions that comes to everyone's mind, that how my data and all the history will be transferred to the next doctor or provider who is going to take care. So I think interoperability, communication between these broken systems is the major challenge where tech needs to do like a lot of work. Last year I was at HIMSS in Vegas, and I see there are a lot of companies who are doing some cool stuff to bring these systems together, building different interoperability like layers. You can say middlewares, so the systems can communicate with each other. But there is still a lot of room for improvement in this particular domain.
Sure, yeah, definitely. So, speaking of a lot of innovative things, let's jump to the topic of AI. So, AI is the next wave. It is different from any past tech adoption. Um, is it different from any past tech adoptions? In your opinion, how has AI entered into healthcare different from earlier technologies? I'd love to hear your opinion. A lot of people are, I would say, adopting to
Mhm.
AI and what it can bring, but it is quite scary. I know I've had conversations with physicians and they are all about adopting AI, but it can be quite
Yeah.
scary, to a lot of people. So, can you tell me a little bit more about this?
Yeah, thank you, Shelby, for bringing this point. So I agree with you, and I would like to answer this into two parts. The first part is about the wave and its impact. AI is fundamentally different from earlier wave of healthcare technology, and most people, most of these past tools, they were digitizing the records or automating the task. Now AI goes a step further. It actually influences the decisions as well, and that's incredibly powerful, but it also carries a real risk. Like when tech starts shaping the clinical judgment, it demands a much higher standard of trust, transparency, and human oversight. Uh, so, what I will say that AI can't just be implemented and left alone. We need to keep the human in the loop. And on the other hand, another impact I have seen, especially at the enterprise level, healthcare companies, they are very skeptical going with these AI LLMs. They wanted to make sure that the data is secure and we have all the security guardrails in place and best practices. Like one of the standard is NIST that people are following to ensure that whenever we are architecting any AI application, we are following those practices. Uh, so most of these big big firms, they are setting up their own on-prem data centers and applying all these best practices to ensure data is not leaving their premises, and they will not be into any compliance or security issues. So I think these are the two things that when we are designing the AI, we need to make sure that data is secure, safe, and we are applying all the best practices. And second thing is that if AI become functional, we need to still keep a human in the loop because it involves a human life. We can't rely 100% on the AI.
Yeah, that makes a lot of sense. So we talked about um, AI and the security, the importance of that in healthcare. Moving forward, how should technology properly be introduced into healthcare, in your opinion? If you were
Yep.
designing health tech adoption from scratch today, what would you change?
Yeah, so I think tech should be introduced by starting with a real clinical and patient problem. We just don't need to digitize the paper or the manual flows into screens. We need to see the real impact. We need to rethink and need to design it around patient care. So at the day end, patient should be getting care at ease and with the best experience. The doctor should be having access to all the data points at one single screen or dashboard where they can make the decisions easily. And all the staffing and all rest of the administrative work should be as less as possible. So they don't end up spending too much time connecting these different tools or doing the data entry into here and there and signing here and there. So I think that redesign or that rethinking can really add value if we do it that way. And I see that a lot of new EMR, EHR, and end-to-end uh, telemedicine and telehealth solutions are coming, which are taking these parameter into consideration, and they are really doing the great job.
Yeah, that makes sense. So, if technology is here to serve healthcare, what should it never replace, in your opinion?
Yeah, so as we have been discussing all through this conversation, so tech should never replace human judgment. Uh, and the factor of empathy or the patient clinician relationship, I think that is really important. So tech role should be to support clinicians, reduce the friction, and make the better care possible, not to substitute the human connection that care depends upon. So in simple
Couldn't
word, I can say that tech can assist care, but it should never replace the humanity.
agree more. If you could give one piece of advice to healthcare leaders, CTOs, or founders listening today, what would that be?
Uh, one of the emphasis that I have been giving throughout this conversation is don't digitize the healthcare problems. Let's rethink them. And what I believe that too many systems today are just paper workflows that have been wrapped into the software or screen. We need to think about real impact at how we can make the things easier. Uh, the question is not why a process exists, and then redesign it around clinician, patient, and outcomes. Uh, we need to make sure that it's not adding too much constraint, roadblocks, not adding too much like complexities, which is making care too much complex for the patient. So tech should reduce the cognitive load, restore time to care, and support better decision. If it doesn't do that, it's just a noise, no matter how advanced the AI sounds.
If we keep people at the center and use technology as a tool, not a replacement, that's how healthcare truly gets better. The future of healthcare isn't about smarter systems, it's about using technology in a way that represents the human side of care. We have the tools, now we have the responsibility to use them wisely. Thanks for watching. Follow our page and stay tuned for more upcoming interesting episodes.